Welcome to Alexandra Hospital. This video is created for patients to show them what happens before, during, and after a major operation. Hopefully, this video can decrease patient anxiety and make it a more pleasant experience. The whole process begins with a consultation session in the clinic. The surgeon will talk to you about why an operation is required and what the surgery entails. The risks and benefits of the operation will be explained in detail. Then you'll be asked to sign on a consent form. After that, the anesthetist will see you in his clinic. He will ask about your medical history, drug allergy, and any previous anesthesia. He will order several tests like the ECG, chest X-ray, and several blood tests to see if you are fit enough for the operation. It will be helpful if you can bring any of your old medications and medical records. Next, you'll be seen by one of our staff for financial counseling. They will explain to you regarding financial matters pertaining to the cost of surgery and hospitalization. You can clarify any matters with regards to Medisave or insurance. On the night before the operation, make sure you follow the anesthetist's instructions and fast after 12 midnight. On the morning of the operation, please remember to take your medications with sips of water. The anesthetist will give you specific instructions on which medication to take and which to omit. When you arrive at the hospital, please proceed to emergency department and register at the counter for admission. The staff will direct you to the correct ward. In the ward, the staff nurse will give you a quick orientation. You'll be given a set of clothes to change into. The staff nurse will then check some basic parameters like your blood pressure and temperature. When the operating theatre is ready, one of the staff nurse will escort you to the OT. Here, the OT nurse will double check that all the relevant documents are in order. The anesthetist will see you in the induction room where he will set up a drip and briefly explain to you the induction process. After making sure that everything is in order, you'll be pushed into the operating theatre. After the operation, you'll be observed in the recovery area for a short while. The anesthetist will monitor your recovery before leaving you in the capable hands of the OT nurse. When you are adequately alert, you'll be transferred back to the ward in a trolley. The houseman will come and review you promptly after the operation and ensure that you are alright. He will update the surgeon regarding your condition. The next morning, the surgeon and his team will make the rounds. They will talk to you about what was done during the surgery. They also advise you on what to do during the recovery phase in the hospital. On the day of discharge, the pharmacist will advise you on your medications. You will be told of the side effects of some of the medications that you might be taking. The ward nurse will give you the discharge summary of your admission as well as an appointment card for your next consultation. A few weeks later, you will be reviewed in the clinic. The surgeon will check on your progress after your operation.